We're here today with Dale Carlson, and Dale is a practicing paramedic. He does this full-time for a living, and what we're going to discuss today is a little bit about the gear that he carries and the importance of the different aspects of the gear. So, Dale, take it away.
Thank you. A full-time paramedic, but I'm also part of a specialized group within our ambulance service. I'm part of the RTF team, which stands for Rescue Task Force. We've developed this about a year ago. We're starting to train with local law enforcement for the possibility of active shooter mass casualty events. The gear that I carry, vest with, we call it an IFAK, individual first aid kit. This is for my treatment, any assistance that I might need, not to be used for law enforcement, any other casualties that we may come across. The RTF team will be operating in the warm zone. Law enforcement will clear the scene. We will follow in to get aid as quickly as possible to casualties in the warm zone, get basic life-saving measures, initially get them moved out to a cold zone casualty collection point, and get them further care. Kevlar vest, or Kevlar helmet, class 3A vest. But on the equipment I carry in, we're not going to be starting IVs. We're not going to be splinting basic bones. We're not going to be putting band-aids on people. Our main goal is stopping major life threats, bleeding, trauma to the chest. We carry some very basic equipment. Asherman chest seals will go in as a team of 2, so we'll have a total of 10 chest seals that we can apply. Tactical tourniquets, again, the number is 5 for us. Looking for bright red blood, spurting blood, but hopefully we can, the people we work with will have their own tactical tourniquets, their own chest seals that they can hopefully self-apply. We can guide them in that. Last few things that we carry, we do have some cling gauze and basic ACE wraps that we can use again for injuries that don't need a tourniquet. So that's the basic supplies that I'll carry. It's always on my rig, it's always in my car if we get the need or the call for doing that. Webbing we can use to make a drag line and or send out to someone who may be able to hold on to it. We can pull them to concealment cover.
What is it that we as individuals who aren't professionals but could have on hand to prepare our own little kit for us that would be critically important? The most important facet.
Starts off with shears so you can expose the wounds. Sharpie pen, you can write right on the skin what you've done. And he's got a tourniquet also right on the top, easy access. You want your needed supplies so you can get to them. You don't want them stuffed in a pocket that you can't reach with both hands. So good to have that right on top. So we're opening it up. He's even got ARS. It is a 14 gauge needle. I won't open it up because it is sealed. It's used for needle decompression of the chest. If you need it, definitely need to be trained on that to help relieve pressure.
That would be like a sucking chest wound.
Sucking chest wounds, yep. Penetrating trauma, or you're struck by something and you're starting to fill up the chest cavity with air or blood.
So the lung collapses and you need to release that pressure.
Release that pressure. Some of the signs, symptoms, difficulty breathing, and some other ones that I won't get into at this point. Flashlights, so you can see where you're going. Sorry, you can't see. Some 5x9 pads, again, for laceration stuff so that you can use direct pressure on. Cling gauze you can use to wrap on that. Israeli bandage, which is a commercial type bandaging. It's got a pad in it. It's got elastic. So it's all in one. You don't have to be opening multiple packages to do the same thing. You can open this on, put pressure, and securely wrap it and stop the bleeding or the hemorrhaging. Gloves, some triangle bandages. You can use those for splinting. You can use them for makeshift tourniquets.
Just an airway.
Nasal airway. With lubricant on the back. Boy, you'd use this for to protect your airway. Say you're not going to be gotten to in a little bit, you can self-administer this, or someone's got a compromised airway, fluids. Actually goes in the nose, lube it up, slide it in, helps protect the airway, keep the tongue out of the way. Hemostatic agent, quick clot, or Celox, actually goes in the wound, starts to help with coagulation of the blood. You can put that on first, follow it up with your bandaging material. It's got some wound prep, some cleaning agents, AAA antibiotic, more for if you're going to be, maybe stuck for someplace for a while. Some steri strips for minor injuries, band-aids, and anti-inflammatory, some pain medication, basic ibuprofen, stuff like that. I love it. A roll of duct tape, good for
lots of things.
Lots of things.
So, I mean, this is good, and people to know that these things are available and they have accessibility for them. But if we were to come down to for not only for self-care, which is like that's where the tourniquets can come in, but also for family or something that's quick response, what would be the basic things that you would say that people should have with them in their car, that if there's something they can grab it quick, or have with it easy access at home, maybe even in your drawer at work? What would be the main things that you would recommend?
We're taught ABCs: airway, breathing, circulation. For us, trauma, you want to stop the bleeding. Without the blood, You don't have the carrier agent for the oxygen.
Right. No oxygen?
Yeah, you
That's
can bleed out in 3.5 minutes if you can't stop an arterial bleed. Whether it's been from industrial accident, car accident, whatever it is, tourniquet for any major bleeding is probably the best thing.
Would you say that in today's world, I know in the past there was always elevation, direct pressure, but would you say in today's world, tourniquet is probably the better way to go first? If you
can't stop the bleeding.
Okay.
Start with what you have. If you don't have this available, if the patient's conscious, have them start direct pressure.
Okay.
Find something to put more pressure on.
There used to be that big stigma that, tourniquet, you may lose a limb, you might lose, and that's not really the case anymore, is it?
Not from what we're hearing. Mark down when you put the tourniquet on. That's what the
pen's for.
The Sharpie pen works good for. Call 911. Get them rolling as soon as they can. As you can see, we're out in a rural area, very rural. Traumatic car crashes, industrial accidents. We've had bicycle accidents out here where we've had to call in the helicopter.
Sure.
Continue that higher level of care. Sure. But with what you've got here, you've got a very good start to stop major bleeding and start to preserve life.
Stop the major bleeding, maintain an airway. Probably another thing, then you can correct me if I'm mistaken, but always make sure that the scene that you're going in, whatever the scene is, that it's safe before you enter in, so that you yourself don't become a victim.
Yep, that's things we're taught from first responder on up is scene safe. If it's not safe, don't enter. You want to make sure you go home at night.
Jim and Dale, thanks for being here today. It's really good to talk about this. As you mentioned, Jim, our whole purpose at Your Security Solution is to help people be more confident and comfortable and safe in their walk of life. And to me, this is important because if we're talking about how to avoid shooters, how to avoid bad guys, how to react when it happens, because sometimes it's just going to happen. We try to teach you so that you don't ever get caught. But if it happens, this can be the difference between life and death. What's the average response time for paramedic up in this area, for example? We're talking 10 minutes plus,
10
right?
minutes plus,
right.
Up to 15, 20, depending on weather, maybe even more.
Right. And depending on the injury, you can bleed out in just 2 to 3 minutes. Right.
Correct.
So this is the kind of thing, by having a tourniquet, quick clot, Israeli bandages, the major bits of gear that you need, and also there in that kit are chest seals, which all of these things are things that can be equipment on hand to help people save their own lives or save others' lives. Mm-hmm. Now, one other thing I wanted to ask you about, Dale, is I took first aid courses back when I was in the military, but that's been a long time ago, and I found that my local Red Cross really doesn't offer anything like that. You have any suggestions for how people can get training, whether it's formal certified training or even if it's just, not the best, but even just knowing what to do?
Believe it or not, the internet has helped a lot with YouTube. You can see applications on how to use different stuff. How to self-apply a tourniquet. Right. Why you would want to self-apply a tourniquet. The use of the Israeli type bandage, how to put it on. You want to be familiar with what you've got. My suggestion, if you want to really try it, buy 2.
Right.
You don't want to be taking this out of the package as your friend is bleeding out and trying to figure out.
Hold on, I'm reading the instructions.
I'm reading the instructions on the back, which are very good, but your mind tends to start to focus down. You're not going to pick up the details. Practice with what you have. Practice, open one up, keep it as a spare. Keep a training kit if you want to train other people.
Good advice.
Just one thing to say in this: you can learn a lot of these things, and you can do self-application or with your family. But there is one important factor: if you take the things you self-learn and you're not medically trained outside and use on somebody else, the Good Samaritan law will most likely not cover you. A Good Samaritan law, which is in all 50 states, means that you can help people at the level of training that you have.
Right.
But if you go beyond that, or you do something that's considered to be creating more harm, as we say, then you could be liable. Just to clarify that the information that we're providing here today, and Dale being a professional, he's trained to use these things, certified to use these things, doesn't mean
while
you
on
can't.
duty.
Yeah, while on duty.
That's right.
Doesn't mean that in your situation at home, in other words, would I try to do a sucking chest wound on my family? You bet I would.
Yeah.
But whether I would do that outside of there, that's a decision every individual would have to make, depending on this situation. That makes sense?
Makes sense. Going back to the needle decompression, that's a skill we learn. This is a piece of equipment I carry on our ambulance, but I can't do it if I was to respond out in this area not being on duty. Would I do it at home?
No
Yes,
question.
As would I. If I had a home invasion and somebody attacked my family and somebody in my family needed that, I wouldn't be worried about certification. I'd be applying it. But you're right. I wouldn't go outside and just say, oh, you've been hurt in a car crash. Let me
needle decompress you.
Yeah, that's what, third rib down, second, third rib
Right.
down, intercostal space. So, and you
Something-
can learn that stuff, but the application, you have to be careful of that.
You will be able to find occasionally, as in my hometown last year, one of the local gun ranges had somebody on staff who was trained in these, certified, and they did provide training on medical trauma training. Hard to find though.
Mm-hmm.
I'd encourage, if you're interested in these things, contact your local gun range, your local Red Cross, even contact your local EMS and police and ask, because in some areas they will let citizens sit in on their training. It may cost you something, but there are options. Building the kit is probably the easy part. Getting the training is the harder part. But as we said, at Your Security Solution, we are motivated by helping you to feel more comfortable in your life, and not comfortable as in ignorant, comfortable as in I'm going to go out there and I'm prepared. As Dale mentioned, we have this little kit. This fits really well in a cargo pocket. When I carry this. Somebody told me once, if you go out prepared to inflict wounds, you ought to be ready, willing, and able to repair wounds. And so I take that as a mantra for me, and so I try to carry these things.
Dale, thanks. Paul,
Thank you.
Thank you.
Thank you.